Substance use and dependency has increased during the pandemic. Sadly, that includes substance use among children. Belinda Post spoke with substance use counselor Molly Pelletieri to learn more about the impact on children's mental health.
Substance use and dependency has increased during the pandemic, and sadly, that includes substance use among children. Substance use counselor Molly Pelletieri joins us to discuss the impact on children's mental health. Molly, during the pandemic, substance use rose in children and teens. Why are we seeing this trend?
Isolation is one of the core issues with substance use in general. And when people are using, it's often because they feel like they don't belong or fit in, or they might have social anxiety. And the pandemic has really impacted people's ability to connect. And substance use is a way that a lot of people are coping, adults and kids alike. We've seen a rise in substance use in middle and high school age children during the pandemic. We saw alcohol use go up, and the use of marijuana has gone up markedly, especially among the concentrates, the vapes, dabs, which is the much higher potency marijuana than the leaf marijuana.
Is there a relationship between mental health issues like depression and anxiety and substance abuse?
Yes, mental health issues can go hand in hand with substance use. And you really can't treat one and hope the other will just get better on its own. You have to treat them together. And if you don't treat substance use, the mental health isn't going to get better. And you can't just give a kid medication and think that the substance use will magically stop. You know, once they decide that substances is a good coping mechanism for them, they're going to continue to use until they find healthier, more effective coping mechanisms and tools to use.
And I know that's something that you really dive into with Crittenden's Children's Center. So how does substance use intensive outpatient program there work, helping both children and families?
Well, we work on coping skills, battling cravings, identifying triggers, dealing with stress, and pretty much how to deal with what life throws you in a healthier way. And if teens are giving alternative ways to cope with what's happening in their life, and healthier tools in their toolbox to use, they'll have a better sense of control about what's going on in their life. And we have a family night. It's a multi-family night where all the kids and their families get together. And there we help the parents as well. We treat the family issues as well as the individual child's issues. And education is really geared more towards the parents, like how to cope with the things that are going on in the home, how to build trust, and how to support their children through the recovery process.
Go to stlukeskc.org for more information on Crittenden Children's Center for treating mental and behavioral needs.